A government science advisor says the Rule of Six law does not go far enough to tackle coronavirus and there should be 4 more measures. A member of the government's Scientific Advisory Group for Emergencies, SAGE, has spoken as the Prime Minister announced new restrictions on Tuesday. Boris Johnson said that all pubs, bars and restaurants including kebab shops and other late-night takeaways must obey a 10 p.m. curfew from Thursday. However, eateries are allowed only to make deliveries rather than take walk-in customers at 10 p.m. All establishments must strictly operate table service only to curb the second wave of coronavirus infections should they continue to rise exponentially. Another 4,926 coronavirus cases were recorded on Tuesday, the highest Tuesday rise since mid-April, and the highest case number since May, with a further 37 deaths. Prof Semple, a professor of child health and outbreak medicine at the University of Liverpool, said limiting groups to 6 people or implementing a curfew is enough to tackle the surging infection rates. He said the UK needed 4 more restrictions: a ban on households mixing, a reduction on sporting events, more stringent measures for the hospitality sector, and further rules introduced in the care industry. He told BBC Radio 4's Today programme on Tuesday, "The time to act is now. We are in a serious situation, and the numbers that are rising are tracking the worst-case scenario, so there is significant anxiety among the science and health community." Close quote, claiming that he was sorry to say that the Rule of Six is not enough. He said, "This is where it will hurt people most. I think we will get to a stage where people shouldn't mix between households. The Rule of Six has been tried and not had time to kick in yet, but based on the numbers I'm seeing it doesn't go far enough, so I do think we'll be restricting intermingling between households." There are several sectors of society that need to increase their restrictions, unfortunately, but it's necessary because we're starting to see a rise in cases, not just in the frail and elderly, but also in people under the age of 50. We're likely to see restrictions on the hospitality sector, and it'll probably have to go further than a 10 p.m. curfew and table service only. Close quote. Cabinet Minister Michael Gove also announced on Tuesday plans for small numbers of fans to return to watch sporting events in England from the beginning of October had also been shelved. "We're going to have to see reductions in sporting events, and that's going to hit many of us hard," Prof Semple said. Prof Semple said a study he runs on hospital cases in England, Scotland, and Wales has shown a rapid rise in admissions. This includes an increase in people aged 20 to 40, particularly women, which he said could be down to community exposure in hospitality and care settings, and a lack of social distancing. On Monday, the government raised the UK's COVID-19 alert level to 4, which means transmission is high or rising exponentially. Sir Patrick Vallance, the government's chief scientific advisor, warned that the number of daily infections could hit 50,000 by mid-October unless new restrictions come into play. He added, without any action being taken, the daily death rate could be as much as 200 in mid-November.